528. Now, the one with the high, now, look what you're doing. You're holding on to the tongs. Hold on to the handle.
What she just
And as
said.
soon as people say, oh, I can't hear anything. Well, no wonder. All right, so we can use a 256, but a 512 is much better if you want to pick up hearing loss. So, up you go. Now, I'm going to use two people so you can see this twice. This is a really easy exam. Now, where's my 512? Right here. There you go. So, I'm going to give you your own personal ear cone, just for you. Exactly. Don't lose these. These are very precious. There you go. You can get one for each ear. Okay, now, we start with the inspection. So, the ear is elliptical. Now, the angle of insertion is less than 10 degrees or less. Now, what that means is that if you just turn your head slightly to the left, the angle of insertion, this would be at 0 degrees. If we look at the angle of insertion, the angle's about 10 degrees, okay? Now, when we talk about low-set ears that we might see in someone who's developmentally delayed, their ears are set at a wider angle. All right, so the ear insertion is at about 10 degrees. Now, no skin lesions are visible. Now you check for tenderness. Let me know if any of this hurts, okay?
No.
Okay, now check the mastoid process. See how I'm palpating? Any pain?
No.
Okay, terrific. Now, I'll pull it a little here. No tenderness. Great. All right. Now, I'm ready to look in. Now, this is my otoscope. Now, how to get this thing on. Now, you'll notice that there's a little elevated portion. This thing screws on like that. So, screw it on so it doesn't fall off. Now, what to do with the cord? Now, I would probably put this behind the ear and probably wrap it under my elbow because I don't want this snapping in his face. Now, I'm going to use these fingers against the face. Now, how do I pull the earlobe? Up and back or up and down?
Up and back.
Good. Now, I'm not going to do this. No, I'd like you to like me. Okay, now I can actually see that we've got a little bit of dry yellow wax. That's fine. And I have a 50% obstruction from the wax. So I see the posterior portion of the tympanic membrane, but I cannot see the angle of light because it's that one little piece of wax. Okay, now, if you'll turn over there. Now, look what's happening with my hands. Now, turn over there. Now, I switch to my left side. Now, maybe you have some more surprises in this area. Okay, now this is the fun part. This is the fun part. Okay, now, we're going to switch. This is your right ear.
Okay.
Now, let's say you came in with complaints of ear pain. You see what we're doing? You better switch cones. You don't want to go from the bad ear to the good ear. Now, up this goes. Now, notice how I'm resting my fingers here. Now, I look first, and then, oh, yay, we've got more wax. Okay, but I see the angle of light at 7 o'clock, and I see the bony landmarks at 9 o'clock, and I see that you have some posterior opacity.
So can you say?
Have you been sick in the last, say, 4 to 6 weeks?
Allergy.
That's right. That's right. Now let me look a little more carefully because I think we're going to find something exciting. Here we go. Now it really helps if I put myself up high. Oh, fun. Am I hurting you?
No.
Okay, guess what? Oh, this is great. Wow. Okay, first of all, you had a little bit more than allergies going on, let me tell you. You have like a donut that looks like a, the eardrum's like sticking out at me. And so it actually has a lot of fluid inside of the middle ear. That's from the allergies. See, the allergies cause the eustachian tube to swell up so it can't equilibrate pressures. So if you've had like air bubble sounds like popping in your ear. That's for sure what I'm seeing. Now, imagine a white powdered donut. That's what your eardrum looks like. The center part goes in, and the outside part lifts out. So that's what I mean by opacity. What a great ear. Okay, now you see how easy that was? The way I described it, now we're not going to say to the doctor, yeah, he's got a powdered donut in there. That's opacity, and the tympanic membrane sticking out at me. Okay, now that was just for your enjoyment. Now let's do the hearing tests. Ready?
Okay.
Now what I'd like you to do is, first of all, I'm going to do the whisper test, or the voice test. I'd like you to push the tragus in and out on that side, and I'm going to say a few words, and I'd like you to tell me what they are.
Good night.
Perfect. Now I'll do the other side.
Ping pong.
Perfect. Now let's do the RNA test. Now when you can no longer hear the vibration, that's vibration, you're going to raise your hand. First of all, I'll put this to the bone, and then we'll compare that by just holding up the tongs. Now you're ready? We'll do it on your right ear first. Okay, here we go. Now,
I can't hear anything.
you can't hear anything.
I cannot hear anything. Oh.
Not even in the beginning?
No.
Okay.
Oh.
Oh.
Okay.
That's 18 seconds. Okay, guess what? Remember I said he had the eardrum occluded by the wax?
Yes.
So I counted about 10 seconds on air conduction and about 18 on bone conduction. So that's not normal, right? Air conduction to bone conduction. Now, we're never going to do what I did. This is just for drama effect. Because I knew that you had an air conduction problem because of what I saw. That's why I couldn't hear anything. So we normally will just crack this against a bone. Now, I got my watch instead, but right there. You can hear this.
Yeah.
Okay, so do we all agree this is an air conduction problem? Now, what he should have had was air conduction 2 times bone conduction. Now, that was a RNA, and it was abnormal. And so what you would say is, the RNA is abnormal. Okay, air conduction was less than bone conduction. Now, I might ask you for an extra point, well, what does that mean? Now, let's do the waiver. Now, I'm going to initiate vibrations. If you hear it equally, let me know.
Well, I don't hear anything.
Can't hear anything. Let's try again.
Oh, you know what? actually, I do hear, but I just didn't recognize the sound.
Well, there you go. Well, you've had a whole new experience. I'm so glad. Okay, because I had some serious worries about you. I figured maybe I'll lend you one of my hearing aids. They're brand new. We can share them. So,
It looks real.
so that was really cute. That was excellent. A lot of people, when they first do this, they don't know what it sounds like. So if you don't give good directions to the patients, how are they going to know? So this is a perfect example. Maybe I didn't do a good job giving directions. Maybe what we should do is we should give the patient a sample of what.
You should hear.
Now I can hear this.
Okay.
Now that definitely is vibration. Why don't we do the air and the bone conduction again, now that you've recognized what vibration